Okay, so get this. Today we're diving into the world of menstrual cups.
Oh, wow. Interesting.
You might be thinking, is that really deep dive worthy?
Yeah.
But trust me on this one, it's
Well,
way more interesting than you might think.
right.
Especially when you consider the source material that you sent over.
Oh, yeah, right. We've got this recent article from BMJ Case Reports,
Uh-huh.
which, it's a well-respected medical journal.
For sure.
And it details a potential health complication that's linked to menstrual cup use.
Exactly. So our mission today is to unpack this case together.
All right.
See what it means for those who use menstrual cups or are thinking about, making the switch. Because let's be honest, this isn't exactly like,
Right.
dinner table conversation.
No, not really.
But it's important.
Absolutely open and honest conversations about these topics are crucial, especially when it comes to our health and well-being.
So let's set the stage a little bit. For anyone who's unfamiliar, menstrual cups are basically a reusable alternative to tampons and pads.
Okay.
They're often made of silicone or rubber.
Right.
It's become super popular lately,
Yeah.
especially for people who are, environmentally conscious, ditching disposables.
Yeah.
But this case report highlights that even with something seemingly simple like a menstrual cup,
Right.
complications can still arise.
Yes. And this particular case involves a woman in her early 30s. She had been experiencing blood in her urine and, kind of this persistent pain in her side and her pelvis for about 6 months.
Oh, wow.
Now, she'd been using a menstrual cup for a couple days each month during, like, her heaviest flow and emptying it every, 2 to 3 hours.
Okay.
But here's where things get a little interesting. She also has a history of kidney stones
Okay.
and was using a copper IUD for contraception.
Hold on. A history of kidney stones and an IUD?
Yeah.
I'm already sensing a connection here, even before we get to the cup itself. It's like a puzzle with multiple pieces.
You're right. Those are definitely important pieces of the puzzle.
Yeah.
So the medical team, they initially thought, okay, well, this is probably kidney stones, right? That seems to make sense.
Mm-hmm.
But a scan revealed something completely different.
Oh.
Her right kidney was swollen,
Okay.
and so was her ureter, which is the tube that carries urine from the kidney to the bladder. And, get this, the scan showed the menstrual cup positioned right next to the opening of the ureter into the bladder.
Wait, how does a cup that's supposed to be in the vagina end up so close to the ureter?
Yeah.
That seems, I don't know, strange, anatomically speaking.
You would think so, right? But the ureters actually run really close to the vagina. So if the cup isn't positioned correctly, it can press against the ureter, and that's going to obstruct the flow of urine.
Okay, so it's almost like if you kink a garden hose,
Mm-hmm.
the water can't flow through properly.
Right.
So I'm guessing that's what led to the swelling in her kidney.
Exactly. That's a great analogy. So the medical term for this swelling is hydronephrosis, and it can be incredibly painful.
Wow, I can only imagine.
Yeah.
So they removed the cup. I'm assuming her symptoms cleared up.
Precisely. So a month later, they did a follow-up scan. The swelling had subsided. The urine was flowing normally.
Great.
And all of her symptoms had completely disappeared. So, pretty compelling evidence that the cup's positioning was really the root cause of her discomfort.
It's easy to just read a headline, right?
Right.
And think menstrual cups are dangerous.
Oh, yeah, for sure.
But this deep dive is already showing that it's way more nuanced than that.
Absolutely. While this case highlights a potential risk, it's important to remember that millions of people use menstrual cups safely and effectively. It's all about understanding the nuances and making informed choices.
Well said. So we've established that incorrect placement can lead to problems. I'm curious, are there other reported cases like this? Is this a one-off? Or is there a pattern emerging?
That's a great question. And, one that I'm sure a lot of our listeners are wondering about. So while similar cases are relatively rare, they do exist.
Okay.
The report authors actually mentioned that a few other similar cases have been reported in medical literature.
That's reassuring, in a way, to know that this potential issue is being recognized.
Yeah.
But I can't help but feel for this woman in the study,
Right.
She liked using the cup,
Yeah,
but she's hesitant to continue, which I totally get it.
of course.
It really highlights this whole risk versus reward dilemma that we face with so many things, right?
Absolutely. It's a valid concern, and it definitely underscores the need for balanced information.
Yeah.
So this case shouldn't scare people away from using menstrual cups.
Right.
But it does emphasize the importance of being informed
Uh-huh.
and making, educated decisions.
Mhm.
Knowledge, in this case, really is power.
And that's exactly what we're aiming for with this deep dive, right? Provide that knowledge and empower you, the listener, to make the best choices for your own body. But before we go any further, I want to take a closer look at the report's call for better patient guidance. This idea that maybe healthcare providers should be more involved in educating people about menstrual cup use. What are your thoughts on that?
It's a fascinating point. Right now, you can buy a menstrual cup without any professional guidance at all.
Yeah, that's true.
So, how do you know you're choosing the right choice? How do you know you're using it correctly? So perhaps involving healthcare providers in the process, maybe even something as simple as a quick chat with a pharmacist, could help prevent these complications and ensure people feel confident and comfortable using these products.
That makes a lot of sense. It's like we have consultations for so many other things. Why not for something as important as menstrual health?
Precisely. This case really raises questions about how we access reliable information about intimate health products and, who should be responsible for providing that guidance.
Yeah.
But before we get too deep into that,
I
think it's important to address the anatomy a little more.
Yeah, let's break it down because I'm sure many listeners are trying to picture this in their minds and understand how a cup in the vagina could impact the urinary system.
Okay, so imagine
the vagina as like a flexible tube. And the cervix, which is the opening to the uterus that's like at the top of that tube. Now the ureters, those tubes that are carrying urine from the kidneys, they actually run alongside this whole area and connect to the bladder, which sits right in front of the vagina. So it's like a pretty close neighborhood, anatomically speaking.
Exactly. And that proximity is really key to understanding how a menstrual cup's position could impact the urinary system.
Yeah.
So if that cup is too high or too wide or not properly opened, it can actually press against the ureter, kind of like a gentle pinch.
Oh.
And that's what can obstruct the urine flow.
Okay, I'm getting a much clearer picture now. So this woman in the case study, they mentioned she had a history of kidney stone and she was also using a copper IUD.
Yeah.
Did those factors play a role at all in this whole situation, or was it purely the cup's placement?
That's a great question. And while the report doesn't definitively say that those factors, directly caused this complication, they do provide important context. So the previous kidney stone, it suggests that there might have already been some vulnerability in her urinary tract.
Right.
And the IUD, while it's not directly involved, it reminds us that there are multiple devices that are being used in the same anatomical area, which could potentially lead to some, unforeseen interactions.
That makes a lot of sense. It's like a reminder to consider the whole picture, not just the individual product in isolation.
Right.
We're all unique. What works for one person might not work for another.
Absolutely.
Even if they're using the same cup.
You've hit the nail on the head.
Yeah.
And that also reinforces the need for more personalized advice and guidance, which kind of brings us back to that discussion about involving healthcare providers.
Right.
So maybe a simple checklist or like a conversation starter could help individuals assess, their unique situation and ensure that they're making informed choices.
I love that idea. A checklist or some sort of guide that people could go through with their doctor or their pharmacist. It could include things like, have you ever had kidney stones?
Yeah.
Are you using any other devices like an IUD? What's your typical flow like? It would really encourage a much more personalized approach.
Exactly. And it would help shift the conversation away from, is this product safe?
Yeah.
To, is this product safe for me?
Right.
Because blanket statements about safety, those could be pretty misleading.
Yeah, for sure.
Especially when it comes to intimate health products.
Okay, so we've talked about individual factors, the need for personalized guidance.
Right.
But before we move on, I want to address something that's been on my mind.
Right.
How should we be interpreting this case report? I mean, one case doesn't necessarily mean everyone using a menstrual cup is going to have kidney problems. Right? We need to be careful not to blow this out of proportion.
You're absolutely right. Case reports are really valuable because they highlight unusual or interesting cases. But they don't necessarily represent the general population's experience.
Yeah.
It's like seeing a news story about a shark attack. It's scary. It's attention-grabbing.
Right.
But it doesn't mean that everybody should be afraid to go swimming in the ocean.
Perfect analogy.
Right.
So how do we balance this one case with the fact that millions of people use menstrual cups without any issues? How do we approach this information responsibly?
It's all about perspective and critical thinking. This case serves as a valuable, I guess you could say, red flag. It points out a potential risk that we may not have been aware of before.
Yeah.
It prompts further research. It encourages us to ask more questions.
So instead of thinking menstrual cups are dangerous,
Yeah.
it's more about thinking, okay, this is a possibility. Let's learn more about it so we can be informed and make safe choices.
Exactly. It's about integrating this new information into our existing knowledge base.
Yeah.
And then using it to make those informed decisions, both individually and as a society.
Uh-huh.
And speaking of safe choices, I think it's important to talk about, some practical steps people can take to minimize the risk of complications like the one described in this case.
Yes, let's get practical. Beyond awareness, what can people actually do to ensure they're using these cups safely, confidently?
Well, the report authors highlighted a few key things. First and foremost,
Okay.
choosing the right size and shape of the cup for your body is absolutely crucial. There are different sizes, different styles available.
Yeah.
Finding that right fit is really essential for both comfort, but also to prevent any pressure on the surrounding tissues.
Okay, that makes sense. How do you know if you have the right fit?
Yeah.
Are there any telltale signs that your cup might be too big or too small?
It can be a little bit of trial and error, to be honest,
Okay.
but a few general guidelines.
Uh-huh.
The cup should sit comfortably inside the vagina without feeling too tight or too loose.
Okay.
It shouldn't cause any pain or discomfort. And you shouldn't really be able to feel it once it's in place.
Okay, so comfort is key. But what about placement? How do you make sure that cup is positioned correctly to avoid putting pressure on that ureter?
Placement is definitely key. So the cup should be positioned below the cervix,
Okay.
and it's really important to ensure that it's fully opened once it's inserted.
Got it.
There are often diagrams and videos available, either online or in the product instructions that can help you with this. It can feel a little bit like origami at first,
Right.
with all the folding and the tucking.
Yeah.
But once you get the hang of it,
Yeah.
it becomes like second nature.
Oh, tell me about it. I remember the first time I tried using a cup.
Uh-huh.
I felt like I was wrestling with a tiny, slippery octopus.
I can imagine.
But practice makes perfect.
It does. It does.
What else should people keep in mind besides size and placement?
Hygiene is really important,
Yeah,
as with any menstrual product.
of course.
So washing your hands thoroughly before and after handling the cup is essential. The cup itself should be cleaned regularly, usually with warm water and mild, unscented soap. Some cups can even be boiled for sterilization. Always refer to those specific instructions that come with your cup.
Got it. Hygiene is key.
Yes.
And speaking of instructions, I'm curious, how often should you empty a menstrual cup? I know in the case report, the woman was emptying it every 2 to 3 hours. Is that like the standard recommendation?
So the general recommendation is to empty it every 12 hours.
Okay.
But, this can vary depending on your flow, so some people might need to empty it more frequently, especially during those heavier days.
Yeah, that makes sense.
While others can go a little bit longer.
So listening to your body,
Uh-huh.
paying attention to your flow,
Absolutely.
it's key, as with so many things related to our health.
Yes, and don't be afraid to adjust that emptying schedule as needed.
So all of this has been really helpful, but I'm wondering, what if someone experiences like discomfort
Yeah.
or unusual symptoms while they're using the cup? What's the course of action? Should they just try to tough it out, or is there something else they should do?
That's such a crucial point. Any unusual pain, discomfort, or bleeding,
Okay.
that should never be ignored. So if you experience any of those symptoms, remove the cup
Yeah.
and consult with a healthcare professional.
Okay, that's reassuring. So it's like anything else, if something feels off, go get it checked out.
Exactly. It's always better to err on the side of caution when it comes to your health.
As we've been talking, I've been thinking about the bigger picture here.
Yeah.
This case highlights a potential issue with a specific product,
Right.
but it also speaks to this broader need for better education and awareness about menstrual health in general.
Absolutely. Menstrual health is still often, unfortunately, shrouded in taboo and misinformation, which can lead to people, feeling uncomfortable or even ashamed
Yeah.
to talk about their experiences or seek help when they need it.
And that's such a shame.
It is.
Menstruation is a natural biological process,
Right.
and we need to normalize these conversations.
I couldn't agree more. The more we talk openly and honestly about these topics, the less stigma there will be, and the better equipped people will be to manage their menstrual health safely and confidently.
This deep dive is a perfect example
Yeah.
of how we can break down these barriers
Right.
and have these important conversations. But before we, get too far ahead of ourselves,
Okay.
let's talk about resources. Where do you recommend people go to learn more about menstrual health,
Okay.
and specifically about menstrual cups?
So there are actually some fantastic resources available, both online and offline.
Okay.
So reputable healthcare organizations like Planned Parenthood
Uh-huh.
or the American College of Obstetrics and Gynecology, their websites have tons of information about menstrual health.
Those are definitely great sources. What about information that's specific to cups?
Many menstrual cup brands actually have detailed information right on their websites.
Okay.
You can also find helpful reviews and comparisons on websites like Put a Cup in It or the Menstrual Cup blog.
Great.
These sites are, they're run by folks who are really passionate about menstrual cups.
Yeah.
And they provide a wealth of information based on personal experience and research.
Fantastic. So we've got reputable healthcare organizations, brand websites, online communities dedicated to cups.
Yep.
Those sound like excellent starting points for anyone looking to learn more.
Exactly. And of course, don't hesitate to reach out to your own healthcare provider if you have any specific questions or concerns. They can provide that personalized guidance and address any, individual needs.
Such good advice. So as we wrap up this part of our deep dive, I want to circle back to what we've covered so far.
Right.
We started by unpacking this really intriguing case report about a potential complication linked to menstrual cup use, emphasizing that, it's a rare occurrence,
Right.
but it's still something to be aware of. We then explored the anatomy that's involved, highlighting how close the vagina, the ureters, and the bladder are,
Yes.
and how incorrect cup placement can lead to problems. We talked about the importance of the right size, the right placement, hygiene to minimize those risks.
Right.
And we also discussed the need for, better education and access to reliable information about menstrual health in general.
Beautifully summarized.
And remember, listener, this deep dive is not about fear-mongering. It's about empowering you with knowledge.
Absolutely.
So you can make informed choices about your body, your health.
You got it. Knowledge is power.
Now, we've talked a lot about the individual experience. But in our final part, I want to kind of zoom out a little bit, explore the broader implications of this case.
Right.
What does it tell us about the way we think about and regulate intimate health products? Stay tuned for that thought-provoking discussion. Welcome back. So we've been deep diving into this intriguing case report about, a potential complication linked to menstrual cup use.
Right.
We've talked about the importance of choosing the right size, correct placement, how hygiene plays a crucial role. But now I kind of want to step back.
Okay.
Look at the bigger picture here. This case really makes you think about how we as a society approach intimate health products in general.
It's fascinating, isn't it? We've, on the one hand, we've emphasized this personal responsibility, urging listeners to do their research, be proactive about their health.
Yeah.
But then on the other hand, the report itself is calling for better guidance, potentially from healthcare professionals, acknowledging that, not everyone has equal access to reliable information or support.
Right. That tension is so interesting.
Yeah.
Where does the responsibility lie? Is it solely on the individual consumer to navigate this whole landscape of products? Or should there be more, formalized guidance?
Right.
Maybe even regulation to ensure safety and informed use? I mean, we have regulations for so many other things.
Yeah.
Why not for intimate health products?
It's a really complex issue. And honestly, there's no easy answer.
Yeah.
So in many countries, including the U.S., menstrual cups are actually classified as Class II medical devices.
Okay.
So that means they're subject to certain manufacturing standards, quality controls.
So there is some level of oversight already.
There is, but, it's primarily focused on the product itself.
Okay.
Not necessarily how it's used or how consumers are educated about the potential risks.
Right.
So, for example, the case report that we've been talking about, it specifically calls for more detailed, user-friendly patient information.
Yeah.
So, that suggests a potential area for, regulatory attention.
Right.
Perhaps manufacturers could be required to provide more comprehensive instructions, warnings, maybe even, resources for users to access professional guidance if they need it.
It seems reasonable. It's like those safety pamphlets that you get with medications.
Right.
You wouldn't just take a new drug without reading about potential side effects.
Exactly.
Or knowing how to use it properly.
Exactly. It's about providing consumers with the knowledge that they need.
Yeah.
To make those informed decisions, especially when it comes to products that are used internally, and, maybe even going beyond that, there could be, some standardized training for healthcare providers.
Right.
So they're better equipped to answer questions, provide advice on these products. Right now, it feels like that knowledge can be a little bit inconsistent.
I can definitely relate to that. I've definitely had experiences where I felt, a bit awkward bringing up menstrual cups with my doctor.
Right.
It just felt like it wasn't really a topic they were prepared to discuss.
Right. And that speaks to the need for a broader cultural shift as well. We need to destigmatize menstruation.
Yeah.
So these conversations can happen more openly, comfortably, both in healthcare settings and in society as a whole.
Totally. How can we expect people to use these products safely, confidently,
Right.
if they're too embarrassed to even ask questions about them?
This case study, while, focusing on a specific complication, really highlights how interconnected everything is. Individual choices, healthcare systems, societal norms, they all play a role.
It's like this domino effect.
Yeah.
If we can address that stigma,
Right.
increase access to accurate information,
Yeah.
it really empowers individuals
Uh-huh.
to make those informed choices.
Exactly.
Which in turn, can lead to safer, more confident use of these products.
Precisely. And that's, ultimately what we want.
Yeah.
To empower people to take control of their own health and well-being.
So we've explored the potential for regulation,
Right.
the need for better education,
Uh-huh.
the importance of destigmatizing these conversations.
Yes.
What's the next step? Where do we go from here? It feels like we've opened a Pandora's box of questions.
Well, what's exciting is that this case report, it really feels like a catalyst for change.
Okay.
It's sparked a discussion.
Mm-hmm.
It's raised awareness.
Yeah.
And hopefully, it'll motivate action. So we need more research to understand the prevalence of these complications.
Right.
We need better guidelines for healthcare providers.
Yeah.
And most importantly, we need these ongoing conversations to destigmatize menstrual health and empower individuals.
I love that. And to our amazing listener, you have a voice in this conversation.
Yeah.
Talk to your friends, share reliable information, advocate for better education. Don't be afraid to ask questions and demand better from our healthcare system.
Beautifully said. This deep dive has been a journey into the intricacies of menstrual cups.
Yeah.
But ultimately, it's about something much larger,
Right.
It's about taking control of our intimate health, demanding access to knowledge,
Yeah.
and advocating for a world where these conversations are open, honest, and empowering.
Such a powerful message. So to our listener, keep asking those questions, stay curious,
Yeah.
and remember, your health and well-being are worth fighting for. Thanks for joining us on this deep dive. Until next time, stay informed and stay empowered.